CICU devices.
Biva-cor, biventricular assist device or total artificial heart. The Biva-cor device is an innovative solution in the field of mechanical cardiac replacement, designed to provide total circulatory support in patients with end-stage biventricular heart failure. It functions as a complete artificial heart, replacing the work of both ventricles by generating balanced and continuous blood flow to the pulmonary and systemic circulations. Unlike traditional ventricular assist devices, which typically offer only left ventricular support, Biva-cor has been created to fully substitute the native heart, providing prolonged stabilization mainly for patients awaiting transplantation, and maybe in the future for those who are not eligible transplant candidates. The design of this device is based on a magnetically suspended rotary disc, capable of alternately directing blood to the pulmonary artery and the aorta. By eliminating mechanical bearings, the system minimizes wear, structural failure, and friction that can cause blood element damage. This principle allows Biva-cor to operate quietly and smoothly, enhancing long-term durability and patient compatibility. One of its most remarkable characteristics is its self-regulating capacity, as it automatically adapts to fluctuations in venous return and thereby maintains balance between the pulmonary and systemic flows. This reduces the need for continuous manual adjustments and ensures hemodynamic stability under changing physiological conditions. The device is manufactured with highly biocompatible materials such as titanium alloys, selected for their durability and corrosion resistance. Its compact size represents an important advantage over previous systems, enabling implantation in a broader spectrum of patients, including women and individuals with smaller thoracic cavities. This reduced footprint is possible due to the simplified rotor-based design, which efficiently centralizes the generation of blood flow. External control systems allow continuous monitoring of flows and parameters, complemented by automated alarms designed to increase clinical safety and ensure rapid response to potential complications. The patient-centered design of Biva-cor is also evident in its focus on mobility and autonomy. Rechargeable, portable batteries provide enhanced independence in daily life, akin to modern ventricular assist devices. For the medical team, implantation requires advanced cardiac surgical expertise and a specialized intensive care environment. However, its design makes the surgical procedure more streamlined and reproducible than earlier artificial hearts. Preclinical studies in large animal models, as well as the first human implantations, have demonstrated its ability to sustain physiological circulatory demands over prolonged periods without the frequent complications observed in traditional devices, such as thrombosis, excessive hemolysis, or mechanical wear. In June 2025, the FDA designated Biva-cor's titanium total artificial heart as a breakthrough device. This will help the future reviews and speed up the process.
If you've enjoyed our video, please press the like button and subscribe to support us so we can continue creating quality content like this.